Hi friends, this is Julia Deetz and I'm doing my disability pamphlet on Prader Willi syndrome. And what is that? Well, it's a basic genetic multi-system disease characterized by lethargy, diminished muscle tone, which is hypotonia, a weak suck and feeding difficulties with poor weight gain and growth and other hormone deficiencies. And that's starting away in infants, right in infancy. It occurs in 1 to 10 to 30,000 births, and it affects all ethnicities, all races, and it equally affects males and females. So everybody is the same. And it is genetic. It's a rare genetic disease, but Prader Willi syndrome is rarely inherited. And because I have to keep this short, I'm going to talk about there's 3 different ways that you can be diagnosed to have Prader Willi. Or there's 3 different types of abnormalities. There is the most common, which happens in 60% of the population that has Prader Willi syndrome. It's a chromosomal deletion. And what that means is that the chromosome, which it's chromosome 15, it's either deleted or if it's there, it does not work. And what happens is that would be the gene coming from the father. So chromosome deletion, that would be the gene coming from the father. Then we have maternal uniparental disomy 15, and that is when you get 2 genes from the mother and none from the father. And that happens in about 35% of the population with PWS. And then finally, a small percentage, only 5%, there's problems called genetic imprinting. And there's errors in the region controlling the gene activity on chromosome 15. And then even rarer than that, less than 1% of those cases could be heredity. And you want to get tested when they're a baby to see if they have Prader Willi syndrome. And early diagnosis is most important. There's many features and characteristics, many physical features. Some of them that I wasn't aware of were the distinctive facial features with a narrow bridge, a narrow head, thin upper lip, turned down lower lip, and a narrow forehead as well. So when you're a baby, it presents itself with like a floppy baby, the hypertonia. Those are the biggest issues. By the time you become 2 years old, you should have normalized and you're growing normally. Then from 2.5 to 4 years of age, you start to put weight on, even though your food intake is the same. And then from 4.5 to 8 years old is the initial, the biggest symptom is that your brain, what happens is it doesn't tell your stomach that you are full. So you never feel satiated. And you keep eating and you have a feeling of excessive hunger. So early intervention is important because there's many things you can do. And one of them, even at 2 to 3 months, is growth hormone therapy. When that's administered, You can minimize some facial characteristics that we talked about. You can increase muscle mass. You can increase stature. You can diminish the fat. And most importantly, you can look more normal. And some behavior issues are also a part of having Prader Willi disease. And lastly, I should wrap it up for just a sneak peek, is that there's many symptoms and not every child has all of these symptoms. They might have some less severe than others and some not at all. Thank you.